Hi, I'm Elise Toribio, social media editor at NorthJersey.com. We've gotten a lot of questions on social media regarding coronavirus in New Jersey, so here with us we have assignment editor Jim O'Neill to help answer some of those questions. So first up, why the panic over coronavirus? The flu has killed more people this year, and what's the difference there?
It's a good question, and in fact, some health officials say we wish there was more focus on the flu. The flu has been really bad for New Jersey so far this year. Since October, the flu and pneumonia have killed more than 1,100 New Jersey residents, and the flu season still isn't over. That said, we have built over time in our body's immunity to the flu. We have not with coronavirus because it's so new. And there's still no vaccine for coronavirus, while there is one for the flu. And thirdly, the coronavirus so far appears to be more deadly than the flu. So as a result, health officials are very concerned about the continued spread of coronavirus.
What are schools doing to combat or procedures they've put in place for coronavirus? I know parents have concerns, students I'm sure do, school officials.
So far, there has been no need to close schools, except we do have one case of a school in Paramus, a private school that closed because some students there were in contact with people who had connection to the Westchester County, New York coronavirus cases. But other than that, nothing so far. If it comes to that, there are measures in place. Usually schools will be closed for 2 weeks because that's the incubation period of coronavirus. And each school district has a plan to have teachers still teach to students at their homes. So using either Skype in some cases or online learning. And the state just recently approved those methods to count as actual school days, because the state law requires 180 days in school, and officials are worried about, well, if you have to teach from home, is that going to be counted? So the state says yes, that will be counted if we get to that point, but we have not yet.
What about public transportation, and what are the measures being taken by those agencies to keep everyone safe?
Currently, there are no plans to reduce service, but what the agencies have done, both here in New Jersey Transit has stepped up its cleaning of buses and trains, focusing on the surfaces that people use, and kiosks and the restrooms in the stations themselves. MTA, which handles Metro North, Long Island Railroad, and the subway in Manhattan, have done the same thing. So they're stepping up their cleaning efforts, but there are no plans currently to reduce actual service.
So what are the testing options here in New Jersey at this point?
Currently, there are very few, actually. The Centers for Disease Control has recently given New Jersey about 500 more testing kits, but they're very limited in use. The problem is they just don't have enough. So even for the entire country, Vice President Pence has said we don't have nearly enough. As a result, some health organizations are starting to create their own tests, including here in North Jersey. They're not ready yet, but they should be soon, so that will help with the process. And even when you do have a test done, it goes to the state lab. When they confirm a case of coronavirus, then that has to be reconfirmed by the Centers for Disease Control. So it's a multi-step process.
And so what are the steps to get tested if you think you're feeling sick or have symptoms?
Well, if you think you're feeling sick, call your doctor. Don't go to the doctor right away. Call first, because in many cases they'll want to ask you a series of questions about what your symptoms are, where you've traveled recently, and that sort of thing, and they might just tell you to stay at home and not come to the doctor's office, because many cases of coronavirus are very mild. They're like flu symptoms or a cold, so the best thing is to just stay home and take care of yourself. If they want you to come in, then you come in, and if they think it's more serious, then they'll put you in a hospital in an isolated room.
Thanks, Jim. Stay tuned on NorthJersey.com for more coverage as we continue to report on this.